Goeienaand, good evening, fellow South Africans and citizens of the world. And I said in a video I just posted up that I'd be talking about the shocking state of hospitals in South Africa. So here we go. And we're going to just talk about one particular hospital, because, I mean, they're all pretty well on the same boat. But, you know, just to give you a focus or an idea of what's going on at Edenvale Hospital in Gauteng, it is absolutely disgraceful. Absolutely disgraceful. And yet they want to bring out a national health insurance scheme on a broken system. How is that going to work? A new mother has recalled the nightmare she suffered after being admitted to an overcrowded maternity ward at Edenvale Hospital in Gauteng. Bridget Shlongwane, 27, said she was among 15 women who were cramped in a ward meant to accommodate 4 people. The ward only had 2 beds, and more than a dozen heavily pregnant women were sleeping on the floor while they waited for available beds, according to Shlongwane. She told the paper, "I was lucky to have had a bed, but it was not nice seeing all those women sleeping on the floor. No one deserves that, not when they are pregnant, at the advanced stage of their pregnancies even." Shlongwane took to social media on Tuesday to speak out about the condition at the hospital after being admitted for 3 days. It was not just about sleeping on the floor, she said. She said, "It was not good at all. Can you imagine what it's like to bath using cold, literally freezing water? One can't even refuse to bath because checkups need to be done." The images she shared were met with outrage. They also prompted Gauteng Health MEC Vandile Masuku to react. He said the conditions were regrettable. Masuku said, "This situation opens patients up to infections and potential illnesses. We requested the hospital to give us detailed explanation of what led to this. It is simply unacceptable for patients to be sleeping on the floor. We need to plan better and respond quickly in facilities to avoid such situations." A nurse at the hospital who spoke on the condition of anonymity confirmed that overcrowding was an ongoing issue. She said, "We have a crisis, really. We've had over 20 patients in one ward who had no beds in one go." Asked why heavily pregnant women were not prioritized when beds were allocated, she said only management could take decisions. She said, "We've been complaining, even the pregnant women, for a while now, with no response. It's unfortunate that management had to act only when the situation was made public." Shlongwane, who was discharged on Tuesday, said she was relieved that action had finally been taken. "I'm glad I'm going home, knowing I've made some difference. Management was angry that someone put the information in the public domain, but most of the women were allocated beds and some were given chairs while other plans were being made," she added. In an earlier interview with the paper, Masuku cited Jubilee, Bheki Mlangeni, Tambo Memorial, Mamelodi, Edenvale, Tele Mogorang and Tembisa hospitals as among the 10 worst performing hospitals in the province. With his portfolio allocated at least 50.8 billion rand, he said he wanted to improve the conditions at the facilities. Now, I want to read you another little story. Okay, and this is a comment by Kanyili Lendiwe, and I know it's over a year old, but it's just been reviewed by Edenvale Hospital and made public after just over a year, and I guess it's as a result of what's going on with the publicity. And Kanyili writes, "My dad, who is 76 years old, blind and suffering from shortness of breath, was admitted at Edenvale Hospital on the 21st of May. He has since been experiencing shitty treatment and been ignored after hours. The night staff are getting irritated when he shouts for help on simple things like being tucked in. E.g., when he turns, which is seldom because he avoids it because of short breath, it's a struggle for him. Sometimes the blankets will fall down to the floor, and he would call for help just to pick the blankets and cover him. The nurses get annoyed. He said one nurse actually told him that she doesn't work for him. He can't call her now. And again, when my mum and I got there on Saturday, we found him so frustrated because his plate of food fell and spilled on his pyjamas and bed and floor. There was a mess. No one came to help him, cleaned up, or even help him go to the bathroom to freshen up. And mind you, visiting hours start at 3 p.m. What makes me more sad is when I called him this morning, he said he has a runny tummy yesterday night and he had to beg to be accommodated to the bathroom. As I've mentioned that he is blind, so can't move freely. He knows how to clean or relieve. He just needs to be guided to the bathroom to do his business on his own. And his heart was heavy. He wants to be discharged. Now he refuses to eat anything. He is scared that he will have problems at night and won't be assisted. I don't want to say much, but I fail to understand why are some of the nurses so heartless to patients. I mean, nursing is a job. You choose and go for training to qualify. Yes, I understand long hours and maybe peanut salary, but the people that are in hospital are not there by choice. They have to go there to get better. Do what you're paid for. Treat people like you would treat your family. There is nothing wrong with public hospitals. It's only the treatment that makes one rather want to stay at home than to be humiliated by nurses and unavailable doctors. Now, I just want to let the wider audience who don't live in South Africa know that South African public hospitals are now commonly referred to as death traps. That's where you go to die, because the treatment of patients in these public hospitals is so appalling. And it is incredibly sad that South Africa has got to that situation. Pre-1994, the hospitals were amazing, but not so much anymore. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video and have a safe day. Bye for now.